Here on 97.3 FM WVLK, we're Dr. K, Dr. Kevin Kavanagh. He is a retired physician and also founder of HealthWatch USA. What is HealthWatch USA, Dr. K?
Jack, we're a nonprofit 501c3 organization that right now is national with a little bit of international scope that looks at healthcare research, trying to make sure that it's done appropriately, and we have an emphasis on infectious disease. And we're also a patient advocacy organization. We have a lot of patients that have joined our organization that have been harmed by medical care in some way. And, well, for the most part, they tend to be more on the professional college side of things. In other words, with researchers that also tend to help us with our articles. So we're quite busy during this pandemic because this is sort of right up our alley.
We have a couple of folks that one's hospitalized, one has lost that fight against COVID this morning.
Yeah, that's not good. We heard that Brent Yonts, who's a past Kentucky representative, has died of COVID-19. He was fully vaccinated, from what I understand, back in February. And Jesse Jackson and his wife, both fully vaccinated back in January, are hospitalized. And so what we're seeing is erosion of vaccine efficacy, primarily in the elderly. When you've been getting the vaccine back in January, February, and you've kind of started to, well, not wear a mask or follow public health advice as strict as you should, all of a sudden now this group of people is getting reinfected. And this is in line with the Israeli data. And one of the things I'm worried about over these next 2 to 3 weeks is that we're kind of in a bad situation where a lot of our elderly population has been vaccinated very early, and their vaccine efficacy may be waning. And a lot of the people who weren't vaccinated decided, well, we need to get vaccinated right now. And they're going to get some good immunity to this pandemic and to this virus, but it won't be there for another 4 to 5 weeks. So we're going to go through, I think, a pretty rough time, and people really do need to follow public health advice. And that, for me, means wear a mask and a high-quality mask. And on top of that, you need to try to avoid indoor settings if you could, because we are at the peak of viral spread right now, along with very high test positivity rates. So there's a lot of virus in the community.
I understand that the FDA is expected to authorize the vaccine today. What does that mean?
Well, that means that it's been given their final seal of approval. And I think a lot of people were hesitant on getting the vaccine until full authorization occurred. So for those that are 12 and older, the Pfizer vaccine is expected to get full FDA approval. And I think that's good news. Again, there's been abundant data on this vaccine, probably more so than any other vaccine we've ever had at the front end during approval. I mean, hundreds of millions of doses have been given, and there have been very few complications or problems that have been attributed to these vaccines. So I think that is very good. And one of the things that people really need to look at and just try to remember your past. I was a physician, Jack, and I can't remember any close relative or close friend or wife of a friend that ever got in the hospital with the flu. And this is my entire career. I mean, of course, people did get in the hospital. People did have trouble. But if you look back at this COVID-19, I can think of 10 people that have either been hospitalized, some have died. I mean, it's just incredible how much more this is affecting our society than past infections. And of course, like we've talked to before, the flu is just a respiratory virus. This COVID-19 affects every organ of your body, which is one of the problems that I think people need to realize, that just when you get over the acute infection, you may be susceptible to long hauler syndrome. Another reason why we should all be wearing masks. I wear a good KN95 or N95 mask. I make sure it's fitted well. You can order those on Amazon. And people out there who say masks don't work, that's absolutely false. They have done tremendous amount of research on masks this last year, and that argument that it doesn't work, really looks at the viral particle size, saying, oh, the virus is too small. Well, that's as measured a dry virus on electron microscopy. That's not the viral droplets that come out of people when they're talking and singing and screaming or whatever. I mean, those droplet sizes are filtered out by masks. And the new thing that was really learned was that those particles were thought to fall off right away. In other words, within 6 feet. But we've now learned that the smaller ones of those droplets, between 10 to 100 microns, can actually aerosolize. And that's the size of the droplets that's spreading this COVID-19. And those are the size droplets that these masks are really effective at filtering out. They're not 100%, mind you. And certainly a cloth mask, in my opinion, is far inferior to an N95 with a virus that has 1,000 times the number of particles produced than last year's virus. So again, wear a higher grade mask.
Thank you very much. We'll talk to you Friday.
All right. Thank you, Jack.
Dr. Kevin Kavanagh, retired physician and founder of HealthWatch.